through your mouth. Let any tension dissolve as we settle into this peaceful space together. Today, we're going to explore something fundamental: understanding your own skin. Your skin is unique to you. No one else has skin exactly like yours, with its particular combination of characteristics, needs, and behaviors. Understanding your skin type and specific concerns is the foundation of effective skincare. When you truly know your skin, you can choose products and treatments that actually work rather than following trends that might not serve you. Let's start by clarifying an important distinction: skin type versus skin concerns. Your skin type is your skin's natural baseline condition. It's relatively stable and doesn't change much over time. Skin concerns, on the other hand, are specific issues that can come and go, that can be addressed and improved with targeted care. First, let's explore the main skin types. Remember, very few people have just one pure skin type. Most of us are somewhere on a spectrum or have combination characteristics. That's completely normal. Normal skin is the baseline we compare everything to. If you have normal skin, you're fortunate. It means your skin is balanced, not too oily, not too dry. It feels comfortable throughout the day. Your pores are relatively small. You rarely experience breakouts or excessive dryness. Your skin tolerates most products well without becoming irritated. If this describes you, your main goal is maintenance, protecting your skin and keeping it balanced. And dry skin feels tight, especially after cleansing. It may look dull or flaky. Fine lines might be more visible because your skin lacks adequate moisture and oil. Your skin might feel uncomfortable, even itchy at times. In cold or dry weather, these symptoms often worsen. Dry skin needs rich, nourishing products that provide both hydration and oils to seal in moisture. Your skin's barrier function may be compromised, so strengthening and protecting it is essential. Oily skin produces excess sebum, giving your face a shiny appearance, especially in your T-zone, your forehead, nose, and chin. Your pores are typically more visible, and you're more prone to blackheads and breakouts. You might feel like your face needs washing multiple times a day. However, oily skin has advantages. It tends to age more slowly because the extra oil provides natural protection and moisture. The key is managing oil production without stripping your skin, which would only trigger more oil production. Combination skin is exactly what it sounds like: a combination of oily and dry. Typically, your T-zone is oily while your cheeks are normal to dry. This is actually one of the most common skin types. The challenge is addressing different needs in different areas. You might need lighter products for your T-zone and richer products for your cheeks, or you might find a balanced product that works well everywhere. Sensitive skin isn't actually a skin type in the traditional sense, but it's an important category. If you have sensitive skin, it means your skin reacts easily to products, environmental factors, or ingredients. You might experience redness, burning, stinging, or itching when using certain products. Your skin might be reactive to temperature changes, stress, or certain foods. Sensitive skin requires gentle, minimal ingredient products and careful patch testing of anything new. Now, how do you determine your skin type? Here's a simple test you can do at home. Cleanse your face gently with a mild cleanser. Pat dry and don't apply any products. Wait 1 hour. Then examine your skin carefully. If your skin feels tight and looks dull, you have dry skin. If you see shine across your entire face, you have oily skin. If you see shine only in your T-zone while your cheeks feel comfortable, You have combination skin. If your skin feels comfortable all over without tightness or excessive shine, you have normal skin. This test isn't perfect, but it gives you a good starting point for understanding your skin's baseline behavior. Now let's move to skin concerns. These are specific issues that might affect any skin type. You can have oily skin with hyperpigmentation, or dry skin with acne, or any combination. Understanding your concerns helps you choose targeted treatments. Acne is a concern, not a skin type. While it's more common with oily skin, people with any skin type can experience breakouts. Acne requires targeted treatment with ingredients like salicylic acid, benzoyl peroxide, or retinoids, combined with gentle, non-comedogenic base products appropriate for your skin type. Hyperpigmentation refers to dark spots or patches on your skin. These can result from sun damage, acne scars, melasma, or inflammation. Ingredients like vitamin C, niacinamide, alpha hydroxy acids, and retinoids can help fade hyperpigmentation over time. But the most crucial step is diligent sun protection. Without SPF, hyperpigmentation will continue to darken and new spots will form. Dehydration is different from dryness. Dry skin lacks oil while dehydrated skin lacks water. Any skin type, even oily skin, can be dehydrated. Dehydrated skin feels tight, looks dull, and fine lines may be more visible. The solution is hydrating products with humectants like hyaluronic acid, along with adequate water intake, and avoiding harsh products that strip moisture. Redness and rosacea fall on a spectrum from occasional flushing to persistent redness to the visible blood vessels and bumps of rosacea. Triggers can include temperature extremes, spicy foods, alcohol, stress, and certain skincare ingredients. Gentle products, barrier repair ingredients, and avoiding triggers are key. Sunscreen is essential as sun exposure can worsen redness. Large pores are a common concern, especially with oily skin. Pore size is largely genetic, and you cannot actually shrink pores permanently. However, you can minimize their appearance by keeping them clear with regular exfoliation and by keeping your skin well hydrated, which plumps the skin and makes pores less noticeable. Fine lines and wrinkles become more apparent as we age. Prevention through sun protection is most effective, but retinoids, peptides, and good hydration can improve their appearance over time. Texture concerns include roughness, bumps, or uneven skin. Regular gentle exfoliation, retinoids, and proper hydration can significantly improve texture over several weeks to months. Now, here's where understanding gets practical. Once you know your skin type and concerns, you can build a routine that addresses both. If you have dry skin with hyperpigmentation, you need rich, hydrating base products plus targeted brightening treatments. Your cleanser should be creamy and gentle. Your moisturizer should be rich. Your treatment products might include vitamin C serum and perhaps a gentle retinoid at night. And sunscreen is absolutely essential every day. If you have oily skin with acne, you need lightweight, oil-free products that won't clog your pores, plus acne-fighting ingredients. Your cleanser might contain salicylic acid. Your moisturizer should be gel-based or very light. Your treatment products might include benzoyl peroxide or retinoids. You still need moisturizer and sunscreen. Oily skin needs these too. If you have combination skin with sensitivity, you need balanced products that don't trigger reactions. Gentle, fragrance-free formulas are essential. You might use slightly different products on different areas of your face if needed. The key is addressing your skin type with your base routine, your cleanser, moisturizer, and sunscreen, and addressing your specific concerns with targeted treatments layered in appropriately. Your skin will also change with seasons, hormones, stress levels, and age. The oily skin you had in summer might become combination in winter. The dry skin you have now might become more normal once you establish a good routine. Stay attentive to these changes and adjust accordingly. Pay attention to how your skin feels and looks throughout the day. Does it feel tight an hour after cleansing? Your cleanser might be too harsh. Is your face shiny within a few hours of moisturizing? You might need a lighter product. Does your skin sting when you apply certain products? You might be sensitive to specific ingredients. Your skin is constantly communicating with you. Listen to it. Trust its signals. If something burns, welcome and breathe with me, in and out. Let any stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone. You're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH balance cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment.
Stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N of 1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N of 1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatments insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68, Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin